Hey guys, my name is Nick Sivrich. I'm a physical therapist, and today I want to go over why if you have the same diagnosis or the same injury or the same surgery, why some of your symptoms or all your symptoms aren't the same. I get this question a lot because I'll have different patients in the gym area, or they'll see each other and they'll have the exact same thing wrong with them, but they'll have totally different symptoms, and they're wondering why. I just had this question the other day from a patient of mine. He has a disc herniation, and it hurts him a lot when he stands. Pain goes down his leg, and he asked me, my friend, has a disc herniation, had one several years ago, same level on the lumbar, the low back, and he was unable to sit because it hurt him and it went down his leg. He was okay standing. He's like, I'm the exact opposite. Why? And it's a very valid question because, why wouldn't they be the same? And it's my job to explain to patients that, especially with a disc, and we'll just use that for an example in the lumbar spine, is that normally when you flex your spine, when you bend over, when you sit, your spine flexes. When that happens, the disc in between your vertebrae, which are the bones that encase the spine, and the disc is just that jelly substance in the middle, and it's just like a shock absorber, it pushes out some on a normal healthy spine. Right now, me sitting here, my spine is a little bit flexed, my discs are pushing out a little bit, normal. Well, when you have a herniation or a bulge, it's already pushed out some. So when you go to flex forward, it pushes out. So if you have a herniation and it's backwards, it's going backwards posterior to you, when you flex forward, it's going to push out more, cause pain. Pain may or may not go down the leg, but it's usually very uncomfortable to sit. I'd say 90% of the time. The percentage could be higher, but just in my experience, I'd say 90% of the time, patients don't like to sit because when they sit, spine flexes, disc pushes out more than it normally does, pinches on a nerve, causes pain. Well, sometimes that disc, instead of pushing straight backwards, it can poke to the right, it can poke sideways. Very rarely does it poke forward, but it can poke sideways. If it's poking sideways, pushing sideways, or even kind of sideways and a little bit backwards, sometimes that flexed spine, it won't push that disc out. But when you stand and extend the spine and it pushes on that, it could push it out, and that could cause the pain down the leg standing. There's different spots of the spine that it could be affecting. So, just because you have that same diagnosis doesn't necessarily mean you're going to have the same symptoms. I go over this also with patients when, they both have their knee replaced. One might be doing well, the other one's just a little bit behind, or one has more strength than the other, or one is able to walk a little bit better than the other, and you can't compare yourself to the next patient. Because there's a ton of things that go into that. Age is a big factor. Male versus female, your weight, how bad it was prior to surgery or prior to your injury. Things like that. If you're a diabetic, all these things play a role, and in order to, for the patient to know, if they're getting better versus the other one, you can't compare. You just can't compare yourself. So I hope that helped this week, guys. Really appreciate you watching and sharing my videos. If you have any questions, feel free to contact me. Otherwise, have a great week, guys. Thanks.